Well, a warm welcome to today's talk. It's Friday the 9th of July. Now, there are concerns all around the world with the accelerating Delta variant. So I'm going to start off with a few examples of that. Countries we maybe don't normally cover. So Tunisia, for example, 11.7 million people. Over 8,000 new cases per day now, actually. That's a couple of days old. About 500,000 cases in total. So we see cases greatly increasing. If we look at the graphic, if we look at here, so we've got previous waves, but then we've got this dramatic Delta increase, and it's probably going to carry on for some time. In Tunisia, health authorities saying intensive care wards are full, and the situation is described as catastrophic by the health authorities in the country. So vaccination rates, of course, very low. Still in Africa, Zimbabwe. New daily cases in Zimbabwe. And again, we see this similar kind of trend, massively more than it has been, and probably going to carry on as well as a result of Delta variant. So way higher than previous waves already. 14.2 million people in the country. Last 2 weeks, the cases have quadrupled. They're back at a strict lockdown in Zimbabwe, which is immensely difficult for poorer people. Delta variant, and the health services are complaining of shortages of everything, basically. You just don't have the resources to cope with this, and people are starting to die unnecessarily already. Namibia. Conny writes from Namibia. Well, I think this is fairly self-explanatory. Well, we face the same or even worse situation than Indonesia, which we reported about a few days ago. Our death rate per capita is one of the highest in the world. No hospital beds, no oxygen. And now we're running out of vaccines, but the world doesn't take notice. So I think that's a fair assessment there from Conny. Basically, lack of everything, escalating cases. And again, this data for the past few days is not particularly accurate. Well, none of it's particularly accurate, but the trend is definitely increasing in Namibia. So thanks for that information, Conny. Vietnam. 96.5 million people. Again, cases have been remarkably low. Vietnam's done particularly well, but they don't seem to be doing well against the Delta variant. It's starting. Ho Chi Minh seems to be the epicentre at the moment, but again, if we look at where it has been, then unfortunately, this is how well Vietnam was doing. Look at these numbers here. They're just basically, essentially nothing. And then there we have the Delta variant. Unfortunately, Ho Chi Minh City is the epicentre. Flights have been stopped. Land controls in and out of Ho Chi Minh are in place. So again, we looked at this about a week ago. Were the Vietnamese authorities able to contain this? It's looking like not. It's just such a transmissible variant. Now, moving on to the United States briefly. Cases are up 11% over the past week. Hospitalizations are up 7%. Very patchy. Some areas absolutely fine. Other areas getting a bit stressful in the United States. Now, Pfizer have developed a tweaked Delta vaccine booster. So they've presumably modified their vaccine to be more specific to Delta variant. FDA will have to approve that, of course, and decide whether it's necessary. But they're putting this forward as 6 months after the second dose as being highly effective against the Delta variant. So again, in the United States now, a third booster dose being openly talked about for autumn and winter. And Pfizer could well produce an awful lot more vaccines for the states specific to the Delta variant. And of course, that will be in demand all around the world. They're saying it would be very highly effective. I just watched a news report. There's not a lot on this at the moment, but they said it's 5 to 10 times more effective. But that doesn't mean anything. 5 to 10 times more effective than what? But given that the original vaccines were like 94% efficacious against the original strains, I don't see why they can't make a tweaked messenger RNA vaccine that is highly specific against the Delta variant. And I would expect it to have excellent efficacy against that variant, if that's going to be used as a booster. Looking like the way things are going. Doctors in Missouri, where 90% of cases, most parts of Missouri, 90% of cases the Delta variant. Doctors anecdotally in Missouri are saying younger patients, more rapid onset of serious illness. So that is qualitatively what the doctors are reporting on the ground. Now, United Kingdom. Now, just before we look at some, we'll look at some, indecision. We'll look at the Office for National Statistics data in a minute. Sajid Javid, just in this morning's paper, new Health Secretary, of course, is saying this. The government is very comfortable with the timetable for ending England's lockdown despite surging coronavirus cases. And we said lately that Chris Whitty looked distinctly uncomfortable at the podium when they did that initial briefing. Sajid Javid has said, bowing to calls from pro-lockdown scientists and others for restrictions to remain after the 19th of July. Then he says something very interesting would risk adding winter pressure on the NHS. So it sounds like, I don't want to put words in Sajid Javid's mouth, but it sounds like he's saying better get these cases over now in summer, otherwise they'll just wait till winter. Because I've had 2 doses of vaccine, and it's more than three weeks ago, it's a month or so ago, more than a month now since my second dose. So my level of immunity now should be good. So if I'm exposed to the Delta variant, that should give me protection against the Delta variant, and hopefully I won't get sick. So is that the strategy he's going for? It's a herd immunity, community immunity type strategy. It's not declared, but that's what it seems. But I just thought that was very telling. For other restrictions to remain after the 19th of July would risk adding to winter pressures on the NHS. We feel very comfortable with the plans we've set out, despite the rises we are going to see in infections. I think they're going to be a lot higher by the 19th of July, expecting at least 50,000 a day by then. I think into August they're going to be even higher than that. So it looks like they want to let people be exposed in the summer months. This is the only way I can kind of make sense of this. But it's the vaccine that's working, and that gives that's what gives us confidence. Well, the vaccines work well, but not 100%. If you don't start opening up now, when? When would you do it? He says. All the public health officials that we have, the scientists, our epidemiologists, are saying that it's much better to open up going into the summer for lots of reasons than waiting to do it in the winter. And it's also the experts have expressed concern about the impact of flu this winter. Now, of course, we had no flu last winter, basically no flu at all, no influenza. So the concern is there that people's immunity would be down, so we'd have a concurrent outbreak of contagious influenza type A with coronavirus potentially. And we know that it's really quite a bad idea to have influenza and coronavirus infection and COVID at the same time. We know that from people that did very badly from early 2020 when they had both infections. So that seems to be the thinking. Let's get this over with in summer. I'm not really saying whether that's right or wrong. I can see where he's coming from. That could be argued. It's a high-risk strategy, and he says we're going into uncharted territory. So I just put that before you because that seems to be what's happening. Not going to stop and think too much about it. That is what's happening. Office for National Statistics weekend in the 26th of June. So Delta variant B1 617.2 continued to increase, of course. Prevalence in England 1 in 260 people, massively up from the lows we were enjoying. Wales 1 in 450, Northern Ireland 1 in 670, Scotland very high. I think the rates in Scotland are actually the highest in Europe at the moment. 1 in 150 people prevalence would have the virus in that week. And of course we are talking very largely about Delta variant even then. So again, this is the week ending the 26th of June. And so here we have the data from England. So this is the Delta variant here, of course, in terms of percentage of cases up to there. The grey is the uncertainty, and this is the old variant down here. So we see massively more of the Delta variant in England as it takes over, as it has done in the world, as it's threatening to do in Europe and other places. And Scotland, fairly similar figures. Now, antibody news is good. Week ending the 21st of June, so always a bit out of date this because they have to process the tests and everything. COVID-19 antibodies continue to rise in line with vaccinations across the UK countries. So most of the antibodies are as a result of vaccination, and the two numbers, the increasing vaccinations and the increasing antibodies, correlate well. And the figures look fairly encouraging. Percentage of adult population tested positive for COVID-19 antibodies. So England, basically 90% there, isn't it? And now it will be over 90%. Now, that's with antibodies of some sort. This doesn't tell you the level of protection, but you would have to think there would be some level of protection there, even although it's not. Though there again, you would expect there'd be some level of protection, but it could probably be low because a lot of these antibodies were in people who'd only had one dose of the vaccine. And we know from other data that people aren't well protected till they've had 2 doses of the vaccine and waited for 2 or 3 weeks after that. So you'd have to say that the levels of antibody here are not that well correlated with the levels of protection. It looks good, but because a lot of these have not had their second dose, they are not adequately protected. Wales, over 90%, 91.8%. Northern Ireland, 87.2%. Scotland, 84.7%. And this is the graphic here, which is also pretty interesting. So these are people that have had 2 doses of vaccine. Now, this line here is people that have had the first dose of vaccine. This line here is the antibody line, the percentage of antibodies in the population. So now we see it's very closely matched with the vaccine. But initially, of course, there were some people, that's probably about, 18%, who had antibodies as a result of natural infection. But now it's fairly correlated with the first dose of the vaccine. But as we know, most of the protection comes with the second dose of the vaccine. So that's kind of where we're at the moment. Remember, this is probably what's going to happen in the UK over the next few weeks, and it really does look like the government are expecting many people to test positive and to be exposed. Now, the government website is laughably out of date. It still hasn't updated the symptoms that people get with Delta variant when they've been vaccinated. And it's easy to remember. You just start at the top: headache, runny nose, sore throat, sneezing. They're the main features, pretty well in that order, starting from the top. Headache, then runny nose, sore throat and sneezing for people that have been vaccinated. People that have had 2 vaccines don't really get the persistent cough, or not many of them. Fewer get the anosmia, and virtually none of them get fever. It's a different presentation. So that presentation: headache, runny nose, sore throat, sneezing. Think, have I got COVID? Test, isolate if necessary. Do a lateral flow test at home, which are available from every pharmacist now, of course. And if necessary, do a PCR test. So there we go. Interesting times remain ahead. The government seems absolutely determined to open up on the 19th of July. And more voices are being raised in opposition to this, but I just thought that was so telling from Sajid Javid, that carrying on restrictions after the 19th of July would risk adding winter pressures on the NHS, meaning that he's expecting people to be exposed. And that's just like a booster dose to most people that have been vaccinated. Most, not all. What's the risk to young people? Hard to quantify. And what's the risk of long COVID? Again, harder to quantify, but both are there to some degree. So I'm more worried about the effects on young people and long COVID now, perhaps, than the amount of people that might die over the summer, although hospitalizations will certainly inevitably increase to some extent. So I think tomorrow I might look at... there's a group of 122 scientists have just published a letter in the Lancet. I think we'll probably look at that to give the counter argument, really. So we have a definite debate going on here between Sajid Javid and official government advisors and many other scientists who've sort of stuck their head above the parapet on this one. And I really can't... I can kind of see both sides of it. I'm not sure I can really come down on one side or the other. I mean, what I can say, me personally, is I will certainly be wearing a mask on public transport and shops and indoor environments after the 19th of July. Okay, that is us for today. Thank you, of course, for watching.